In clinical practice, I often end up working with people who've been dealing with the same pain condition for years or even decades. And typically, the longer that these people have been suffering, the more doctors and practitioners of various sorts they've seen and the more diagnostic testing they've had. And yet it never ceases to amaze me the amount of basic and critically important information that has been previously overlooked or missed altogether prior to undergoing their initial examination here. And so in this video, I want to demonstrate the importance of proper diagnosis and targeted treatment and show you so that you can see firsthand the danger of what happens when these things are missing. Let's get into this. Recently, a gentleman named Jorge came in to see me complaining about severe pain in his right arm and shoulder. Now, the pain had been going on for the last 4 years, and he'd already been to see several other doctors about the problem. He'd been given 2 courses of anti-inflammatory medications. They'd treated his arm and his shoulder and even his back, but he hadn't had any resolution or even any improvement. Over the last several weeks, he'd become increasingly concerned because his pain had increased significantly in its intensity, and it was now to the point where it was interfering with his ability to sleep at night and to use his right arm. And whereas in the past, he used to be able to find a position that would relieve his pain somewhat, there was now no comfortable position that he could hold his arm in. The most basic and fundamental step in any physical examination is to physically look at the affected area. So we had Jorge remove his shirt, and it became obvious immediately that he was holding his right arm in a guarded position close to his body like this in order to protect himself from the pain that he was experiencing. And because he was guarding it so closely, I was really curious what the functionality in that shoulder was going to look like. So I had him perform several active ranges of motion, and as you can see here in shoulder flexion, the left or unaffected side moves perfectly well. The right side he actually does a pretty good job of. Although if you pay attention close, you can see that he hyperextends his lower back to help generate momentum to swing that arm up, and he also hikes the shoulder a little bit, indicating that he's overusing his right trapezius to compensate for some kind of intrinsic weakness in the shoulder. He also complained of mild pain at the top of the motion. There was also some very minor weakness in the muscles of his rotator cuff, although there was no pain with any of those tests and nothing that would indicate a significant tear. What was super interesting though was when I went to test his rotator cuff, my left hand lightly grazed the skin of his upper chest, and he jumped in response to that light pressure, which was the first big clue about where his problem might actually be coming from. You see, different spinal nerves are responsible for carrying sensory information from various parts of the body. These are referred to as dermatomes. And because Jorge's hypersensitivity was located in this one small region, it can really help us to hone in on where his problem might be coming from. And we can then use a pinwheel or pinprick sensation to fine-tune exactly what level is affected. And then we can further follow up on that by testing the associated deep tendon reflexes. Pinwheel testing confirmed hypersensitivity of that C5 dermatome on the right-hand side, and the deep tendon reflexes on the right side were diminished by approximately 50% at the level of C5. One final clue was that strength testing of his right deltoid, which also happens to be innervated by that C5 nerve root, showed a significant deficit, like a 20% loss of strength, and he also had significant pain when performing this test. So there was plenty of information at this point for us to shift the focus of the examination up to his lower cervical spine, specifically focusing on the area around C5. I started off by assessing the basic functionality in his neck, and just watch how he rotates to the unaffected side. Smooth and easy. Now compare that to how he rotates his neck towards the right side. And with lateral flexion, his range of motion was even more restricted, and he experienced significant pain in both directions. I then moved on to some basic orthopedic testing, starting with the cervical compression test, which, as you can see, caused severe pain along the right side of his neck, and it also reproduced the symptoms at his right shoulder and his right inner arm. It caused pain in exactly the spot where he's had pain for the last 4 years. We then proceeded to the cervical decompression test, which immediately reduced the pain in his right neck and the pain in his right arm significantly. Now there was enough solid data points to come up with a working diagnosis, which in this case was a right posterolateral disc bulge at the level of C4 and C5, putting pressure on that C5 nerve root, causing radiating pain into that C5 dermatome, ending up in the right shoulder and right inner arm. The final step here was to put Jorge down onto the table and palpate the affected area to confirm my suspicions. And as soon as I got him down onto the table, there was extreme tenderness to the touch on the right-hand side at the level of C3, C4, and C5, with associated muscle spasm consistent with the body locking down and guarding a site of injury to protect him from that pain, and there was restricted motion. Now, it was time to get to work. So I started Jorge off lying on his back with his head in a slightly elevated position to make sure that I wasn't putting any additional pressure on the disc or nerve root. I then used the softest foam roller that I have to gently begin reintroducing extension into his cervical spine and begin easing the gelatinous portion of that cervical disc back into its proper position. I then performed some myofascial release and some extremely light adjusting to restore motion to the affected area, and then I manually pumped the disc. The treatment session was capped off with targeted red light therapy directly to the C5 nerve root on the right-hand side and instruction in a couple of exercises that Jorge was going to be performing on his own at home. Just take a look at Jorge's before and after ranges of motion in cervical rotation. Pay attention, of course, to how far he goes into rotation, but also to the quality of the motion, the expression on his face, and how willing he is to put himself into the position. It was so cool. After the treatment, he had this look of disbelief on his face, and he was actually wiping tears from his eyes because he was so happy to be able to move again without pain. At the 1-week follow-up appointment, I'm happy to report that Jorge walked through the front door with a completely normal arm swing and carry position at that right shoulder and arm. No more guarding or protecting that side. He maintained normal range of motion in cervical rotation and had a massive increase in left lateral flexion in the cervical spine, although there was still some work to do into right lateral flexion. He also reported that he was now sleeping through the night on a consistent basis, and he had a massive increase in his functional capacity and his ability to use his right arm on the job. So overall, this was a massive success, and he's well on his way to a complete recovery. Guys, the reason that I made this video is to show you the importance of doing the detective work, of gathering all those data points so that you can come up with an accurate diagnosis and then formulate a targeted treatment plan to address that specific issue. Doing that is literally the difference, in Jorge's case, between 4 years worth of pain, discomfort, not sleeping at night, and having an arm that doesn't work properly, and a few weeks worth of rehabilitation. And that's why I'm constantly stressing the importance of self-assessment in the content that I put on this channel and in my flagship program, the Pain Fix Protocol. Now, if you want to find out more about that program, click the link in the upper right-hand corner of your screen. Beyond that, I just want to thank you so much for watching. Make sure to hit that thumbs up button before you head out of here, and I'll see you next time.